I just wanted to come and make an appearance on Facebook and give you guys an update about what's been going on with me. I get a lot of questions and people asking, and I'm an extrovert. I have nothing to hide and I love to educate people. And so I thought I would just give an update about what's been going on with me for the last couple of weeks. So for any of you who do not know, I actually had brain surgery 2 weeks and 2 days ago. I am slowly recovering. If you're interested about the brain tumor and what was removed and how all of that worked, I actually did a Facebook post a couple of weeks ago, so please check it out if you guys have questions on that. But people have been asking kind of how I'm doing, how recovery is going, and I just wanted to come at you for a couple of minutes and just give you guys updates because I like to educate people. So things are going a little more slowly than I think I wanted. I spent the first couple of days in the hospital, about 5 days total. I think it was mostly a blur and I don't quite remember it. I am on some extremely powerful medications for brain swelling. And dexamethasone, a steroid, which actually causes me to not sleep. Pretty much at all. I sleep about 2 to 3 hours a day, and it's usually broken up over time periods. However, I just ended the medication yesterday, and so I'm hoping that things will kind of come around and I'll get a little bit more energy. Ironically, I am not in pain at all. There is no pain. That was probably my biggest fear, was that I was going to be in a lot of pain, like an actual incision site pain and from the surgery, and I don't. Instead, I feel pressure. Sometimes it gets a little bit achy, like a sinus infection, and tightness in the area in the head, and it causes me to be dizzy. So what happened is we went in, we removed the tumor, and the process of my brain swelling in reaction to that, the surgery went really well. It actually was only a 3-hour surgery when it was supposed to be 6 hours. It came out really nicely. They replaced the covering of my brain with a collagen fiber. They put the skull back in. I'll go ahead and actually just show my scars. So they only did an incision where they needed to and only shaved where they needed to do the incision. So it follows along right here and then curves around. I don't know if I can show you towards the back. They actually removed and pulled back the skin and then removed the skull and went from there. We're seeing what's going to go with my hair. We're going to just let it go for about a month and I'm just going to go with it and see what happens. It's kind of fun to have an interesting haircut. My daughter told me that I look very steampunk, especially when I had the staples still in. I did get the staples out last week and I met with my physician assistant. She talked to me and is telling me that the recovery is going to be slower than what I thought. So I am adjusting to that. The nice thing is I am changing my pace of life. I think it's actually coming at a really good time for me. I am able to work when I want to work, and when I need to take a break, I take a nap. And I do that, and my family has been amazing. My friends are absolutely amazing. Please just let me tell you, if you ever have anybody who has a kid or goes into the hospital or is dealing with anything, setting up a meal train should be your #1 goal. I am so incredibly thankful for all of the food that people have brought me. It has been amazing. I start my mornings with good intentions and thinking I'm going to conquer the world and I'm going to make breakfast. I get about 3 minutes into it of standing into the kitchen and I have to call my husband in and I'm like shaking and saying, I can't do this, you got to take over. So it is so nice to not have to worry about dinners. So I just wanted to do a huge shout out thank you to everybody who has been bringing things to me. I cannot tell you how much I appreciate it. And I would encourage you guys to do that for other people because it is an amazing blessing. Other medications that I'm currently on, I have to take anti-seizure medications to try and prevent seizures. I actually had a seizure 2 days before surgery, just a local seizure. It actually did facial contortions. I made some awesome facial expressions, and then my arm went numb and the first 3 fingers went numb. It lasted for about 45 minutes before all the symptoms kind of resolved, but because of that they put me on anti-seizure medications. I'm not allowed to drive yet. I am about 3 months away, maybe 2 months away from 2.5 months away from being able to do full exercise. But I have been walking, and it actually feels really good to walk. And so I've been trying to walk 1 mile to 2 miles every day, and I've pretty much accomplished that. And it actually feels really good to move my body. The reality is that not exercising is like taking a depressant. And so I find when I start to kind of feel down on myself and feel like, you know, the world is ending, because I definitely have my moments where I am extremely emotional. I find if I take a shower and I go out and I go for a walk, I feel 100 times better. And I'm really appreciating that in my time. And some of my friends are coming to walk with me, which I really appreciate the company, because I am an extrovert and I do enjoy company just for short bits of time. I take Tylenol. I am off narcotics because I really don't have any pain, but I do feel the pressure, and the Tylenol does relieve the pressure a little bit, which I appreciate. I'm trying to think of anything else that I should give as an update. Originally, we thought that the tumor was benign. They're no longer calling it benign, but they're also not calling it cancer. It's somewhere in between. I am being referred out to a cancer center. It grew faster than what we thought it was. We thought that it had been a slow developing over the course of my entire life. And when they actually did the biopsy of it, they found that the mitotic factor, the growth factor of it, was a lot faster than that, which probably explains why I didn't have signs and symptoms earlier. And so all we're doing is starting conversations with the cancer center, and that's in the process right now. We don't know what the course of treatment will look like. There's a chance that I might need chemo or that I might need radiation, but we're holding off on those discussions until we run a few more tests on the biopsy. So that's kind of where we're progressing. So my recovery is slow and it might get a little bit more delayed. But at this point, it's just good to start conversations and to know what's happening. And I feel empowered to do that. I love using my brain. I can't read yet. My eyes go buggy when I start reading books, but I'm trying to do that. But I'm working on puzzles. I watch Netflix, which actually is driving me insane, and I get very bored of it very quickly. But I'm listening to podcasts and doing personal development and listening to audiobooks, which I absolutely love. So that's kind of how I spend my day. I do stay on the couch most of the day, except for when I get up and walk around, and I try to do one outing a day where I go and do something. Today I got to go to a meeting with Christian leaders in our community, which I absolutely loved. I am actually going to go out to dinner tonight because it is our anniversary, Corey's and mine anniversary, so I'm excited to do that. But I do try to get out of the house once a day. I try to go for a walk once a day, and I try to shower every day. And those are like my 3 goals in life right now. If you guys have questions, I am more than willing to share. I have no problems sharing information with you guys, so you can always ask down below in the comments. But I just wanted to give an update and let everybody know I am recovering. It's more slow than I wanted to. I originally was set to be able to teach at the University of Oregon in the fall, and my doctors have talked to me and told me that they are not recommending that. However, I will pick up and begin my work at Lane Community College again part-time in the fall, because I teach my favorite class and probably one of the easiest classes to teach, and I have amazing reinforcements at LCC to be able to help me with that class. And so I will be teaching part-time in the fall for Lane Community College, but that will be my part-time, and then running my online business, and I will not be teaching at the U of O. So that's a big change in my life of slowing myself down and just trying to find the balance. So that's my biggest thing right now, is finding balance. I start with a lot of energy and passion, and then it quickly wears off. So I'm trying to learn the point of which I can stop before I get too tired. So if you have questions, please ask down below in the comments. I'm more than happy to answer, but I wanted to give you guys an update, and I hope you all have a wonderful, wonderful day.